Welcome to Surgical Secrets with Dr. Nair, your front row seat to the world of plastic surgery and biopolymer removal. Thinking about a transformation? Or just curious? Revealing the facts and debunking the myths. Dr. Nair cuts through the noise. Surgical Secrets with Dr. Nair.
Hey guys, welcome to Surgical Secrets with Dr. Nair. I'm the host, Kathy, and today we're with the one, the only.
Hey guys, it's Dr. Nair. I'm a double board certified plastic surgeon here in Miami. I have about a decade worth of experience, and I'm one of the few experts in biopolymer surgery. So I'd like to welcome you guys to the first episode of my new podcast, Surgical Secrets with Dr. Nair.
So here we're going to be talking about everything you need to know about Nair Miami plastic surgery, also with a couple of insights and entertaining stories to tell. This podcast is here to help, support, and inspire you in every step of the way. All right, Dr. Nair, how are you feeling?
I'm feeling great. Excited to be here.
Yes, our first ever podcast. That's
I know.
Crazy.
It's exciting.
New beginnings.
Yeah.
He just opened up his new plastic surgery place.
I did. Yep.
And now here we are.
Yep. Crazy.
So a lot of the audience here watching us don't really know you. So who's Dr. Nair?
I'm a board certified plastic surgeon, Buffalo Bills fan, and one of the things I like most is really engaging with my patients and trying to educate people on plastic surgery.
And what made you get into plastic surgery? How was that?
So my training was pretty extensive. I started out doing general surgery, board certified in general surgery, and then I did plastic surgery, and then I did 2 other fellowships after that with craniofacial and aesthetic. But plastic surgery was always interesting to me because I think one of the nice things about plastic surgery is you can operate on any part of the body. So, we can operate from the head down to the toe. It's very complicated. It's very artistic. And it really gives you a chance to kind of make people feel good about themselves. Yeah. So I enjoy that part of it.
And how was the schooling? Did you, a lot of viewers here watching are probably interested and probably inspired by you and want to go down the same route. So what is some advice they could give to them? I know it's not easy.
Yeah.
So.
It's really got to be a passion. I tell people if they can think about themselves doing anything else, they should do it. But if their passion truly is medicine, then you should definitely go for it. My experience was, my training was pretty extensive. I knew I wanted to be a surgeon from when I was a kid. So, I got into med school from high school. So I did a 6-year medical program with Penn State and Jefferson and Philly. After that, I did my general surgery training at the Cleveland Clinic in Florida. And then I did plastic surgery training in Chattanooga. Then I did an aesthetics fellowship in Laguna Beach. And then I did a craniofacial and pediatric fellowship in Milwaukee, Wisconsin.
And overall, how long was it?
So 14 years.
14 years.
Yeah, including medical school.
A lot of hard work.
Yeah, it's very long road.
And is there anything that, any mentality, anything you always told yourself throughout those 14 years to keep you going and to keep you?
You just got to push harder. Every time you feel like you've reached your limit, you got to push harder. I think one of the tough things where, in high school, you feel like you're one of the smartest kids, and then you get to college and you're surrounded by a lot of other smarter kids. Mm-hmm. And they are just as good as you are, just as smart as you are, just as talented as you are. And you just got to be willing to push it. That's really what it is. I think that in any point in time, even through my surgical career and just things that I felt like were difficult for me, I just kept being like, all right, well, this is tough and I feel bad and I feel like it's hard, but I'm going to keep going. So I really would try to just push my limit. And every time I felt like I was giving up, I was like, all right, let's keep going.
Yeah. And at some point you already made it that far that it's what are you going to do?
Yeah.
It's discipline.
Yeah.
I do see that you post a lot about your father, how he was a strong worker and he really motivated you in that aspect. Tell us about that.
Yeah, my dad, I don't even have a memory of him before 2nd grade because he was just working all the time. My dad came from India when he was older after he did his PhD, and he went to Memorial Sloan Kettering and worked with some really, really great men there. Excuse me. And then after that, he just kind of worked his way through, every issue and obstacle that was in his way to get to where he was. So I mean, I remember wanting to hang out with my dad so much. We used to have these old PowerPoints, and you'd have to like press it. Now PowerPoints are on the computer, but you have to like physically press it. And I remember I woke up early on like a Saturday morning just so I could hang out with him. And like the whole goal I remember thinking at that time was I wanted to press it as soon as he was done to like be like perfect, which is like crazy. But like, I mean, I just remember like wanting to like impress him. I thought he was the smartest guy in the world, and so it was a big thing. It was a big thing for me.
That's really good.
Yeah.
Really awesome how your dad really inspired you and to keep up with the big hard work. And it's really good you telling the audience about your journey. Now that you already became the surgeon, you've been doing surgery for 10 years, you spoke about. 10 years, you finally opened up with your own surgery place, Nair's Miami Plastic Surgery, which I'm super excited. I'm super happy for you.
Thank you.
It takes a lot to do that.
Yeah.
And just tell the audience what were your feelings? Like, how did that make you feel? How was it? Just tell me about it.
You know, it was great. It's a mixture of like a lot of excitement, a lot of nervousness, a lot of like fear. You're like hyper controlled. I mean, you want to make sure everything is done exactly the way you want it. You want to make sure like, you're doing the cutting edge surgery. Is there anything you can do differently? Anything you can do better? Are patients happy? Is there an issue that patients want me to do differently that I can do that's going to be safe? So, it's a lot, but I think that's part of owning your own practice and trying to just deliver a better product to patients that you feel like, encapsulates your personality better. So
Correct. A lot of patients are really happy.
Yeah.
The support was insane.
Yes, it was.
We're super grateful for that. We love each and every one of you.
Yeah, love our patients.
Yes. So a question that I wanted to ask is, what would you say differs your place, your practice, from any other practice in Miami?
I think that I have a hyper aggressive focus on like patient communication. So, my philosophy for medicine is, it's kind of like dating. I mean, you're not going to go out and like have a relationship with somebody that you don't have anything in common with. So I really want my patients to like understand my personality, understand how I approach medicine, understand how I approach pre-op and post-operative care, what my philosophy on surgery is, what my philosophy on, how I can deliver the best results to you possible. So I really just want to be really hyper aggressively honest about who I am, and I want patients to either like that or not like that. Because, I don't get offended or anything like that if people are like, he's not my vibe, that's not something that I like. I would rather it be that way rather than people have this misconception of me and then be disappointed. So my goal really is just to be as honest as possible so that we can have like a more effective relationship.
And people love that.
Yeah, I think it's a good way to be. Yeah.
That's what got you to where you're at right now. And like I said, the support, the way patients every day, they literally bring you gifts, flowers, chocolates.
Yeah, it's really awesome.
Tagging you. You post about your own personal life. They always interact with it. How does that make you feel also? Because that says a lot about you.
Yeah, no, it is pretty amazing. There's always going to be ups and downs in surgery, but the support from like patients and like the way they resonate with you, I think that at a mature stage, that's really what keeps you wanting to keep doing what you're doing. Because after a while, like you just feel like what you're doing is the same thing, but when you like see the impact you have on patients, like for them, like it can be your 2000th breast aug, it's not really making a difference, but for them, having them feel better about themselves, having them like feel like they're more confident, they approach life differently, like even a small thing like that like really makes your day because you feel like that's what you were able to give to that person.
I've literally had patients cry to you.
Yeah,
I've been there, seen patients cry like, thank you so much, like they literally see you as like their superhero. You saved my life. Yeah. I always hear that, you saved my life, which is beautiful.
Yeah, I don't know about all that. I'm just trying to deliver, make sure they're okay. But yeah, it means a lot to me. It's very touching, and it's it keeps me going.
So where do you see yourself in 5 years? Near Miami Plastic Surgery specifically.
That's a good question. Hopefully we can kind of develop a lot of things, and we're having a lot of issues with biopolymer surgery in the United States. It's not as well known. There's not a lot of people that are teaching it. I mean, no one taught me in residency at all. Like even with the residents I talk to right now, their exposure to it mainly comes through me. I mean, they've never really seen it or heard about it anywhere else. So it's something that I want to develop nationally, like a standard of care, so that people don't feel like they have to go out of the country to have that kind of surgery. So that would be my goal. And then obviously, I'd like to expand, have like other surgeons join me so that we can have a more robust practice.
So you're one of the few doctors that does biopolymer, right?
Yes.
And so a lot of people don't know what that is. Do you mind telling us, like, what is that?
Yeah, that's a great question. So it's a catch-all term for basically anything. So people that go to people that aren't doctors, not even nurses sometimes, just like common people that are just injecting whatever into the buttocks. A lot of times they're telling people it's filler or like hyaluronic acid, but it's really not. I mean, it could be anything from cement, methacrylate, which is like surgical cement, silicone, but it's not like the high level silicone that we use on implants. It's just like liquid silicone. I mean, it could be anything. I took I don't even know half the time, sometimes some of the stuff, I took like some kind of like white liquid out of somebody the other day. It's a catch-all term for anything that's foreign that is injected into the body.
And it was 15 years ago all of this was happening.
Well, yeah, I mean, it still happens now. Oh, yeah, it still happens now. Yeah, I mean, there was just a big thing about like a major influencer in LA who was having it injected and, she passed away. So, I mean, aside from the long-term complications, like as you're getting, you can die from it. It's not like it's no big deal. It's a huge deal. Yeah.
Wow.
Yeah.
And this happens a lot in Venezuela, right? Or anywhere?
It can happen anywhere. It's very popular in Venezuela because it used to be a very common practice in Venezuela, but it happens all the time. I mean, it happens a lot in Miami, it happens a lot in New York, and it happens a lot in LA. So, I mean, those are the three hubs in plastic surgery in general, but it happens a lot in those areas. But yeah, in foreign countries, the majority of it was very popular in Venezuela, but yeah, it happens all over the place.
And what do you believe are some things that patients should know before getting their procedure?
I really like patients that come like very well educated about who I am and like what I do. Patients that are really in touch with like other patients. Like I really encourage people to like talk to all my patients and like get in a group together and have conversations because
you would put them in group chat.
Yeah, because I mean I think that is great. Like I want them to like understand the experience and everything and not have it come from me too. Coming from like an unbiased source.
Yeah.
So it's nice that like I want people to be like, oh, I've been following you for years and I'm excited. Like that to me makes me like, oh, okay, like you know what I'm about, you know what I do, you've seen my results. Yeah.
I know people who hasn't even had surgery with you and they're already posting you, oh, my doctor, I'm gonna have surgery with him next month, and I see that and I'm like, mind you, I recently just started working with you, so as you guys are getting to know him, I'm also getting to know him. And seeing those things, I just feel like it's so important.
Yeah.
So important. Yeah. And it's like, it's so cute.
Yeah.
It's so cute.
Yeah, it's like a real relationship. So like it's always crazy to me when people are like, I'll ask when we do our exams, like we'll ask them like, oh, who'd you have surgery from? And they'll be like, oh, I don't know. Like that always blows my mind. You know what I mean? Like to me, that's crazy.
They always.
Yeah, you should know it's Dr. Nair did my tummy tuck. Dr. Nair did this. Yeah, that's more important to me.
But you had them, I remember I was speaking with a patient and she was like, yeah, because this patient and that patient and whatever patient, she was saying their names. I was like, how do you know them? She was like, oh yeah, I have a group chat with them. Yeah. The biopolymer group chat. Yeah. I was like, what? She was like, yeah, Dr. Nair has a WhatsApp group chat of all of us. She was like, there we talk about how we're feeling after procedures. Like, there's people who, we're all getting used to this. We all don't know about this. And like we all communicate, support, build friendship. That's beautiful.
Yeah, I think they're specifically, they are very supportive and they're a great community. I mean, they've been fantastic for me. I know they've been fantastic for each other. I mean, I've had women a lot of times there's a lot of shame in it. Like people feel like, a common thing, which I don't agree with is, they're like, oh, I made a stupid decision. Now I get a stupid prize. I mean, I think that's unfair.
Yeah.
I mean, a lot of times people just don't know and they're being lied to by these people. Like they're not being honest about, hey, I'm not a doctor and I don't know anything about this. I haven't done the research. If there's a problem, I don't know how to fix it, like. So I think that's unfair, but they feel a lot of shame about it. They feel a lot of embarrassment. So, they don't particularly want to be like outwardly talking about their experience and stuff like that. But at least in this group chat, like they're very supportive. I had a lady who had like nobody to like help her and take care of her. She didn't know what to do. So I was like, hey, I talked to some of my patients like, hey, do you mind like just messaging her and just like making her feel better? Like, cause she doesn't really know what to do. She's kind of nervous. And like, like a ton of them messaged her like, hey, this is what you do. If you have this, we're going to help you out this. I think you should buy this. I mean, all that stuff is like little bits that I can't really be there for because I don't really, I'm not a part of that as much as I would.
You also have to do your own thing.
Right.
Helping the patients,
right.
The procedures,
right.
Organizing Nair Miami Plastic Surgery. So even with all of that on top of yourself, you still find your way.
Yeah.
Which is beautiful. Yeah.
Yeah. No, it's great.
And you make them help each other.
Yeah, it's really nice. It's a fantastic community.
So going back to what are other things you feel that they should prepare for before having surgery?
So what I would do is get to understand me, get an understanding of what you need to do preoperatively. You want to get your labs done, and you want to get your labs done 30 days ahead of time and send them to me as soon as you can. Because a lot of times, what we find is like, these are healthy people. And sometimes, things have gotten missed. I mean, I cannot tell you how many times I've diagnosed things on patients that other doctors have missed because patients don't show up for follow-up, or they don't do this, or they think, oh, I'm okay. And so we have to really make sure that you're medically optimized to have cosmetic surgery. I mean, I tell people like this, like if you have a broken knee, it's not like we're not going to fix that knee. You know what I mean? But if you don't get a tummy tuck, nothing's bad is going to happen to you. You know what I mean? So the level of risks that I can take as a plastic surgeon is minimal. I mean, it's never going to be zero, but it has to be as low as possible. And we have to do things to just try and identify that. It doesn't necessarily mean that you're not a candidate for surgery, but we got to make sure. Yeah, we got to make sure you're okay. Yeah.
So going back to that, what do you believe would be the biggest misconception about plastic surgery?
That's a good question. I think one of the biggest misconceptions is that everyone's a candidate for plastic surgery. And I mean, that's just not true. I mean, like people will think, oh, it's just a breast aug. It's just a tummy tuck. That's not a thing. I mean, surgery is surgery. I mean, we're cutting into people. We're breathing for them. We're monitoring their heart rate. It is as invasive a procedure as anything else you think would be. So we have to take it with that same level of aggressiveness to safety that anybody else would. So I think that's the misconception. People think, oh, it's just a breast aug. That's not really the case. You still got to make sure that you're 100% okay. You understand the risks. You understand if there's a complication, can I fix it? How do I fix it? All that kind of stuff. So those are the things that, people are like, oh, it's no big deal. I'm like, no, it's a big deal. Yeah. I mean, this is surgery. It's not, we're not walking down the park, So yeah, that is what I think is a big misconception.
I also feel like some patients, they show you a picture. Yeah. They're like, yeah. This is what I want. That's not your body.
Yeah.
It doesn't mean it's going to typically look like that. Some people are more petite than others. Some people are larger than others. It all depends. Yeah. Especially when it comes with the BBLs, you know. Same thing for tummy tucks, everything.
Yeah, I think I ask people to send me pictures mostly because it helps me understand.
At least have an idea.
Yeah.
But it doesn't technically mean that.
Right.
That's not your body. You don't look like that. You're gonna have the same vision, kind of.
Right. Yeah, I think a lot of that is very much like misconceptions patients have about themselves and what surgery can do. Exactly. So I think a lot of times it helps me to kind of guide their expectations. Like, look, you're not going to look like that. Like we're going to make you look better, but you're not going to look like that person.
Fit for you.
Yeah.
So you were talking about that when you were a kid, you always liked med school, right? Mm-hmm. What made you have that passion?
I mean, I don't know. I mean, honestly, I mean, since I was a kid, I remember when I was a kid, I watched this like Nova special, which is like the special they used to do like on PBS, I think. And it was like about like a surgeon who was operating, I think he was operating on like a kid. And that was like the first memory I had of like almost anything. So, I mean, from that age, I knew I wanted to be a surgeon. I mean, it was never like I wanted to be a policeman or anything like that. Like I just always wanted to be a surgeon at that age. So, I mean, it was never anything else, to be real honest with you.
And there you just 14 years.
Yeah.
You did it.
Yeah, for sure.
That's amazing. And what would you say to the people who are stuck? And because I know a lot of people, they don't know what to do. They are in nursing med school. They feel like they're stuck. Have you ever felt like that? Is this even my career path? Is this even what I truly want?
Yeah.
So many years, so many everything. Like,
yeah, I mean, for me, actually, that was the case. I mean, I did like an accelerated path. So I finished college in 2 years, and I was in med school, I think around like at the age of 19 or something like that. So I was super young.
Wow.
And like I had gone through like my first and second year
And
med
what
school.
schools?
Jefferson,
Okay.
yeah, in Philadelphia.
Okay.
And I was in the middle of med school and had just been accelerated. And I was kind of like, is this going to be the rest of my life? You know? So I remember I took like 6 or 7 months off. And I came down to Miami, and I just kind of like hung out, and just did some research and just kind of relaxed and kind of got my mind straight again, and then
To
went
see
back.
exactly
Yeah, just to see what I wanted to do,
Yeah.
make sure it was something I wanted to do, and then went back.
That happens to most of us.
Yeah,
You
yeah,
think you want something, you're into, like, do I even want this?
Yeah.
This is your career for the rest. You feel stuck, which is normal.
yeah,
And I know, like, you felt that way too.
yeah. For sure, I did. For sure, I did. Yeah, you're always going to have moments of like self-doubt. And I think it's always good to like step back and maybe get some clarity. And I think for me, that was kind of what I did. I just stepped back and wanted to make sure, you know, this is really something that I wanted to do. This is really something I wanted to dedicate my life to. And to me, like, it was just like a reaffirming moment. I was like, yeah, it's either this or nothing, really.
Yeah.
I mean, I didn't really have a backup plan now that I think about it. I mean, I was just, it was always going to be that. I don't know what I would have done without that. So yeah, I mean, it just was always my thing.
So what would you say was your most emotional, really heart-touching moment with your patient?
Probably a lot of the recent ones I've had are just, you know, cost stuff. So a lot of the issues that we have with biopolymer patients is, you know, they're very complicated surgeries that I just can't safely do in an outpatient setting. So, you know, a lot of times I have to take them to the hospital, but the hospital doesn't view this as like, you know, emergencies or anything like that. So a lot of difficult times you have to schedule the outpatient, but the hospital costs are very expensive. I mean, to have surgery in the hospital when you're not on insurance, I mean, it's an insane amount of money. So a lot of times these patients are like, well, I just can't afford it, you know, like I just can't afford it. And it's like a very terrible because you just don't know what else to do. So, you try to I tried to hook them up with other surgeons, but a lot of other surgeons didn't want to do the surgery. So, you know, we end up trying to find a way to get them the care that they want. You know, a lot of times we try to discount the prices to make it tolerable for them to be able to have the surgery. One lady, you know, she couldn't afford it, or she couldn't afford it. We didn't know what to do. So I just ended up doing it for free. And just so she can kind of get the care that she needed. But I mean, it's a problem because it's not like one or two people, it's a lot of people.
Yeah.
So you know, you can do one or two things once time to try and help people out, but there has to be a plan. And, you know, unfortunately with health insurance and hospitals, you know, everybody's, you know, has a profit margin and this, and somebody has covered, and it's not just me. Like if it was just you operate, you know, I do your surgery and then you go home, it'd be one thing, but you need nurses, you need hospital care, you need sometimes other surgeons. Sometimes I have to do surgeons with an orthopedic surgeon, or I'll need a vascular surgeon there. I need other doctors to help in that care. So it ends up becoming very complicated and very expensive fast. So I think being able to take care of people and trying to get them through and navigate through some of that, I think that's probably been one of the most refreshing moments in my life for me.
They could literally die.
Huh?
They could die?
Yeah, I mean, sometimes when you do that surgery, it's a little dangerous.
Yeah. No, but if they leave the biopolymer on them, the risk factors, and you just feel like it's all in your hands.
Yeah, I mean, yeah, exactly. It just gets worse and worse. I mean, you know, I've taken biopolymers out on a 70-year-old, and it's not the same as operating on a 30-year-old. You know, like it's just, you get much more worried about complications. It's harder for them to like tolerate it. It's way more nerve-wracking. You know, so yeah, I mean, you just want to try and get it out as much as you can as soon as you can.
Is there any case, like the worst case you've seen that you're like, what are people putting in these things?
I had a lady from Ecuador come, and it was just like, it looked like cement. I mean, literally it was just like thickened cement-like tissue. It was crazy. I don't know what that was. I mean, yeah, I mean, a lot of times when you have like people from other countries coming in, you cannot trust that they have like any kind of normalized stuff. Like, I mean, silicone is bad in itself, but at least the patients that have gotten injected in the United States, the majority of them, it's just silicone, you know, like it's like that clear gel kind of stuff. But when people are coming from other countries, I mean, you don't know what you're going to get when you're in there, you know? So those are the things that are a little bit more crazy. Yeah.
Wow.
Yeah, that stuff's crazy.
And she got it done at Ecuador, or?
Yeah, she had it injected in Ecuador, yeah.
In Ecuador.
Yeah, that was crazy.
And how was she feeling when she heard about that?
Oh, I mean, you know, I don't think, I think a lot of times, like, they just don't know. I mean, they're not really, there's no, like, you know, if I come and operate on you or I do a procedure on you, I mean, there's a whole huge conversation that you and I have. I think with them, they're just, you know, they're just like, I'm going to inject this. Okay. You know, like, there's no conversation, there's no discussion. I don't even think they know what they're getting and they're being lied to. So it's not I think the level of surprise that these patients have are just like, oh, you know, of course I got tricked or something like that.
Yeah.
Yeah.
It's really important to talk to the surgeon and like at least know what you're getting yourself into. Know the type of person he is. Get to know him, meet him, everything before doing a full. Having someone literally play with your body parts.
Yeah.
Cut you open, do everything.
Yeah, it's super crazy. Yeah, you have to have a conversation. I mean, I tell people there really is no such thing as a stupid question. I mean, if you were worried about it or you have a question about it, ask it. I mean, it's always better because even, you know, as I'm trying to explain things to you, there may things that I think are like very common sense that may not be to you or vice versa. So always ask the question, always get clarification. It's never annoying to me. So just whatever you got to say, whatever question you have, just always ask it. It's always easier.
And is there any things you feel like patients should know about post-op care before they get this surgery?
Yeah, a lot. I mean, every surgery, post-operative care is very, very different. Like, for instance, my breast patients, I don't massage them. I don't technically use those bands unless I feel like there's a situation where an implant's too high or something.
Massages are really important.
Yeah, but I don't massage the breast. The only thing I like massages for are for lipo. So any area that you have lipo, yes, I want massage. If we're talking about like biopolymer surgery, then you've got to make sure you're not sitting on it. Very similar to the BBLs. I don't have them sit for about 6 to 8 weeks. And you just want to protect the incision. So every surgery has a different type of postoperative care, and you should really be discussing that with your surgeon and making sure that you have a great understanding of, look, after surgery, what's the next step? What do I do here? How do I recover? What are things that I can do to, you know, make my recovery easier? Those kinds of things are important.
And just at least know that it should be 6 to 8 weeks off.
Yeah.
A lot of people don't know that it's going to be that long.
Yeah.
And then they get surprised when you tell them, you're like, oh, but I have my work.
Right.
Like, I have to be in bed for that long.
Right.
They need to know that it's also part of it, a lot of bed rest care.
Mm-hmm.
You know, you really need to rest, make sure your incision heals, it's clean, everything. You want to massage, obviously if it's for lipo, etc. But just get the best recovery you can.
Yeah. Yeah, I think it's very important to understand what your recovery is and really be, you know, aggressive about taking care of yourself.
So why exactly is biopolymer called biopolymer?
It's just a catch-all term because like colloquially, we say silicone because majority of the cases are silicone. But, there are patients that have, other materials injected. So either industrial grade silicone, which is like this thick, like it looks kind of like sandpapery kind of liquid. Other people have cement injected. Some people have oils injected in there. So like a term to include everything is what that biopolymer means. So biopolymer is it includes anything that's a foreign substance that's injected into your buttocks, face, legs, lips, anywhere.
Legs even?
Yeah. Yeah, I've had a patient injected in her ankles, which is, I don't know why, but yeah, I have to get that out.
And how long till when you have your biopolymer till you start noticing, like, I need to take this out, like this is already doing me? So I know when you first get it, you're all happy, you're like, oh, beautiful.
Yeah, so that's a good question. So the short answer is it just depends on each person. So some people get it and, they go 10, 15 years with no complications. But the problem is that you're going to get it. It's just going to be later. So what I tell people is that, having surgery at 30 is different than having surgery at 70. So even if you have no symptoms and you have no issues, it's coming. But having surgery at 30 and recovering from it is way, way easier than having surgery at, 65, and now you have heart disease, you have lung disease, you got high blood pressure, and now we got to go to the hospital, and, it's a lot more complicated. So the answer is, anytime you have it injected, if you've made that unfortunate decision, hopefully you get it out as soon as you can. But in the scenario where you feel like you're not having symptoms, I still urge you to get it out because it's always easier on you and me when we take it out in a non-symptomatic situation, like such as like you're not having pains, you're not having color changes, your skin's not dying, you're not having rip-roaring pain walking, all that kind of stuff. It makes the surgery way more easier and it makes the recovery a lot easier as well.
And when long till you start seeing those?
It depends. I mean, so some people have injected and like within 3-4 years, they're having bad symptoms. I've had people for like 20 years and don't have symptoms. It just depends. I have people go from like, I was fine a year ago and now my skin is black. So it's just super dependent. I have people that were like, 2 years ago, I was fine and now I can't walk that well. Or, a year ago I was okay and like now I have pain shooting down my leg. So it's so arbitrary, but it happens.
And what can they do to make sure, let's just say patients don't know much about like procedures, what can they do to make sure what they're putting in themselves is not that?
You got to ask. Yeah, that's a great.
Can I get done instead of, let's just say they want it for their butt.
Sure.
Have a bigger butt, have that.
Sure.
Should they get a BBL instead? What questions should they ask? What should they know to make sure they don't have to go through?
Yeah, so that's a great question. I think one of the two ways of doing that is you have to educate yourself. So get inside the community of what you're trying to look for. Let's say you want to make your butt bigger, or you want to make your lips bigger, or something like that. Go look at those patients and what they did. The other thing is you want to seek advice from reputable sources, meaning in the sense that you want to make sure who's doing your procedure, who you're asking for advice is a board certified plastic surgeon. And I mean, we use that term a lot and it's like really meaningless. I mean, at the time
people don't.
Yeah.
What would that mean? Like,
correct.
I'm a board certified plastic surgeon. What should patient know about that?
Yeah, it's crazy. I mean, the amount of times people have asked me if I'm board certified is like minimal, but to us, it's like the most important thing because it's
patients don't even know. I don't know.
It's very difficult. So plastic surgery is a specialty that's regulated by the American Board of Plastic Surgeons, and that board is one of the ones that is recognized by the American Board of Medical Specialties. So there's a big difference between saying that you're a cosmetic surgeon and saying that you're a plastic surgeon, in the sense that the training that we have, the amount of vigilance that the board has about who they say is okay to be board certified, who they say is not. I have to do a test every year. I have to submit case logs. I had to do a written exam. I had to do an oral exam. And after I passed all those exams, then I was able to call myself a board certified plastic surgeon. So the level of testing, the level of what we had to do to get where we had was much, much more vigorous, much more vetted, so that the experience that we have and the opinions that we give should hold more validity. So I think that for me, I think that if you're asking a board certified surgeon, the response that you get is more trustworthy. I think you can kind of say, okay, well, this person has been through a lot, has a lot of understanding, has a lot of reading. That is what this person does. So you can say that it's somewhat of an expert opinion.
Okay.
So yeah, so things that we can do. So a lot of these patients come in because they want to augment their butt. So they say, I like my figure, but I want to have a bigger butt. So a lot of times, unfortunately, these women are skinnier. So they may not have enough fat for a BBL, and a BBL is known as a Brazilian butt lift, or basically fat transfer. So we take the fat from the abdomen and the back, and we transfer it into the buttocks to give you a nicer shape and or a bigger size of the buttocks. But if you're small and you don't have a lot of fat, then that may not be an option for you. So usually in those cases, you're regulated to one of two options. So one option is what we call a liquid BBL, which is what we use fillers. Now, this is where people get confused and they don't know, what do I get? So really, it has to be a filler that's FDA approved and that is done by a board certified plastic surgeon or a board certified professional. So it could either be a dermatologist or a plastic surgeon. Those are the two people I would go to.
Just plastic surgeons who are not board certified, still doing the fillers, still doing everything that they should.
Yeah, I mean, it's not they're plastic surgeons. It's more like it's just like a random, like your neighbor. Yeah. That's usually what it is. Okay. It's like your neighbor who has like a med spa who's like, I got this stuff here. Because you can't get these things. Like no board certified plastic surgeon has liquid silicone. We don't have that stuff. I mean, it's just like we have the fillers, the nicer stuff. They come pre-packaged. They're FDA approved. They're like sterile, all this stuff. This is just like free floating liquid that people are injecting. It's crazy. They're injecting them in hotels. Like I've had patients be like, I got it injected at a hotel room. Like you should never be having surgery in a hotel room. That's just a crazy thing, So it's never like, I mean, it's pretty clear that, if you got a feeling like, hey, something's off, that you're probably right. Yeah. You know what I mean? So yeah, the fillers that we use is either, for me personally, I use Radius or Sculptra, and those are the two injections that have been used to kind of give you a little bit of volume, but they're not going to give you a huge amount. So if you're looking like, hey, look, I want to really make a difference, then usually implants or like buttock implants, that's usually what we use.
Okay. So to avoid biopolymers, you just need to make sure it's with a board certified plastic surgeon.
Yeah.
And not no one else.
Yeah, and ask to see it. Ask to see the syringe. Like if I'm ever injecting, like I show you the syringe, you see the expiration date, it's coming from a company. It's not just like a liquid of a jar of liquid sitting there that I'm pulling up with a syringe and shooting you down. That's craziness. So yeah, I mean, you want to. And always ask. I mean, here's what I tell people. When you ask people and they waffle on the question, something's up. So like, if you're going to ask me, hey, are you board certified? And my answer is anything but yes, then there's something else is going on. So, you just have to find a way to get over being awkward and asking those questions, and you just ask them. And then the answers that you get they're either going to be honest or hopefully, or somebody lies, then you have to double check. And you can always do that by going on the American Board of Plastic Surgery website and verifying if your plastic surgeon is board certified or not.
So I always see that your patients always feel comfortable to text you, DM you on Nair Miami Plastic Surgery on Instagram. And even if they had surgery with you a year ago, 6 months ago, hey doctor, like I just wanted to let you know, like this is how I'm doing, like, etc. How does that like make you feel, like the comfort for them to go out their way and still, after time of seeing you, time of having the procedure with you? Still? Yeah,
I mean, I like that. I mean, I like to keep in touch with my patients. Like, I try to tell people that, I really would like to be friends with you. I like to talk to you. I like to see what's going on in your life.
Even FaceTime them.
Yeah, I mean, I got a lady who is having, a health issue that's completely unrelated to plastic surgery, and she just felt like she wasn't getting the proper care, so she was asking my opinion. So I was helping her out with that, giving her suggestions. A lot of times I have patients that go through, something else in their life, and they'll let me know, and I try to reach out and make sure they're doing okay. So for me, I mean, it's just my personality. I'm not going to be, that would be crazy if somebody messages you like, hey, I'm not feeling good, and I just not respond. I mean, that's just not my vibe.
People who are like that.
Yeah, but that's not me. So, I mean, I really want to be like friends with everybody. I mean, if you trusted me with your body to have a safe result and a good result, like, I'm going to show you that respect back. So, I mean, I really hope that, like, we're friends and we talk for a while. And I tell everybody, like, it's not like you have surgery and then I don't ever see you again. Like, you still got to see me all the time. So, yeah, I think it's better that way.
Yeah. So what are some things that could stop a patient from having plastic surgery? Because I did see that you mentioned that due through, like, their health, or I don't know if it could be some patients that they're diabetic, or some patients that have certain
Yeah, that's a good question. Like I said before, not everybody's a candidate for plastic surgery.
Yeah.
And trying to figure that out is like a multifaceted situation. So you have the medical issues, you have mental issues, you have financial issues. All those three things, like, come into play. I mean, it really has to be a marriage of, the perfect circumstances. So in terms of health-wise, if you have health issues, it doesn't mean that you can't have plastic surgery, but you need to make sure that everything is clear. So let's say you have diabetes, you need to make sure that's under control. Let's say you have high blood pressure, you need to make sure that's under control. Let's say you have some kind of a kidney issue, you got to make sure that's under control. Let's say you have a GI issue. So anything has to be controlled, and I need that.
Have those things, but yeah.
Right. I just need that specialist opinion on whether or not you're safe. Because I've had cardiologists say, hey, look, she's a moderate risk. If you're a moderate risk, that's not safe. That's not okay for me. Like, you have to be low risk for me to be able to take you into plastic surgery.
I know patients who've been held back
due
to those things.
Right.
And I thought my surgery was going to be tomorrow. Like, what happened?
No. Yeah. And you have to get everything done in time. So a lot of times patients will come and tell me, I have all my stuff, and you're showing up like 3 days before surgery with your lab's not done. You're going to get canceled. I mean, there's not the way. The other thing is lying to me. I mean, I cannot tell you how crazy it is and how many times patients have lied to me. I don't know why you think that's a good idea, but about their health. It's just nuts.
To get the surgery.
Right, yeah. They'll say, oh, by the way, I have this crazy medical condition I forgot to tell you until 2 days before surgery. I mean, you're like, why? Why are you playing with your health that way? Yeah, it's crazy. People care less about their health than they do about looking good. And
that's not good.
It's horrible, but it happens, unfortunately.
Yeah.
I mean, we had a recent issue where people were smuggling urine. I mean, so they were smuggling urine in there. Yeah, and now we have to send people in there to watch you pee because we can't trust you. So there's just a lot of craziness out there, and it's definitely few and far between, but a couple bad apples ruins it for everybody. So those things, you kind of have to take steps and, okay, well, there's somebody out there doing something crazy. I got to make sure everybody's doing it the right way.
Yeah.
So aside from, like, medical issues, you want to make sure that your mind is right. So I have a lot of people who are nervous, which is absolutely normal, but there's also a level where that level of nervousness you have is going to affect your care. So there's actually a really interesting study that came out that shows that people with positive attitudes have less complications. And I mean, I think that's really true. Like, I've had people that are, like, on the table and, like, super freaking out. I'm like, look, I don't think we should do this. You know what I mean? Like, this is not it's not appropriate. Like, your mindset's not good. It's going to be a problem. And I've had patients that have had completely perfect results that just obsess and nervous, and they're like, I feel like they give themselves a complication. And you just have to, like, find that sweet spot of, look, I know I'm nervous, but I've done enough research. I trust my surgeon, and I feel like I'm okay with it. And if you're to that point where it's so bothersome to you that you can't really do this in an enjoyable fashion, then don't have surgery. I mean, you know what I mean? Like, that's okay. It's okay to not have surgery. And if you're not in that mental headspace, don't do it. Like, nothing I say will convince you, then, like, that's a no-go to me. Like, I've canceled patients on table because they're just terrified of, like, not making out of the surgery. And I'm like, look, if you're this terrified, we can't do it. Like, come back another day, find another surgeon that makes you feel comfortable. I don't know what it is,
Have you had patients have full-on panic attacks?
I've had like one or two. I mean, it's not very common, but yeah, I had one lady who just was like freaking out, like wouldn't, like on the table, we're about to put her in anesthesia and just freaking out, worried she's not going to make it. And I canceled her. I was like, look, it's not a good day. I don't know what it is, but you're not feeling good. Like, we've talked so much about this and your anxiety levels through the roof. I'm like, this is just a no-go, you know, like, I don't know what it is. I mean, I don't, you know, I just believe in that gut. And my gut was telling me at that time, it's not a good vibe. Let's not do it. And I didn't do it. And then, you know, the funny part is right after I told her, all right, look, you're canceled. She was so mad. She was like, no, I want to have surgery. I want to have surgery. I'm like, nah, it's not happening. I don't care how much you pay me. It's not happening. You know what I mean? Like,
at least another day.
Yeah, no, I mean, it's just, and the other thing is like, you know, drugs. Like, if you come in like positive for cocaine, like, to me, I'm like done, because if you're really coming into surgery positive for drugs, you're not taking your recovery, you're not taking your surgery seriously.
Nothing seriously.
Yeah, so even if we wait 3 or 4 days for you to clear out, I'm still not going to do it for you, because it shows me that like you're not taking this seriously. Like, this isn't a big deal to you, and it's a big deal to me. So
it's like disrespectful.
Yeah, I mean, it's just that, look, at the end of the day, I'm responsible for you, and if you're doing things that are going to make yourself have a problem, then it's going to affect me, it's going to affect my career, and it's just not, it's just not,
it's going to be on you.
Yeah, and it's just a nightmare. It's just not, it's not something that I want to be a part of or responsible for, so that's the other thing.
Nicotine and weed and other things.
Yeah, like, you know, you should know that showing up to surgery, at least for plastic surgeons, I mean, it's like one of the worst things is smoking, because it causes so much problems for the nipple, it causes so much problems for our abdominal flap, you know, any of that kind of stuff. So nicotine positivity.
What could be the outcome of being positive for drugs, whether it's cocaine, weed, nicotine, any of those things, and still doing your surgery? Like, what's the biggest risk factor?
Yeah, I mean, none of us.
A lot of people don't take it seriously, because a lot of people like to smoke, like to feel these things, and they think, you're not going to know. Nothing's going to happen. It's stupid. What is something that patients should know? Yeah,
first off, we're going to know, because we test you, so that's not going to work. But you can try, but we're going to test you. But with cocaine, it's a no-go. I mean, it's not even a no-go, mostly because we're worried about the heart. We're worried about that you can go into a cardiac arrest and possibly die. So it's a no-go. With nicotine, there are some surgeons that will do it, some surgeons that don't. And a lot of it, what it is that you want to get worried about whether or not the flap will be successful. So anytime you do liposuction, what do you
mean by the flap?
So anytime you do like a tummy tuck or a breast lift, we call those flaps. So the reason why I call those flaps is we're cutting off blood supply, so we need it to be robust. And if you're smoking, you're closing down the blood vessels for a certain amount of time, and it can prevent healing. It can cause increased risk of infections. It's just bad all around. Yeah. And with liposuction, you can cause infections. You can cause the skin on top to die. You can cause like necrosis. It's just a bad idea. It's not good at all. I mean, it's just really bad. So you really gotta, if you're a smoker, obviously you should stop smoking, but at the very least, you should stop smoking. 6 weeks before and 6 weeks after.
So the whole recovery, okay.
Yeah.
Wow. So you were saying how financially a lot of people are not prepared for the surgery, so I want to also talk about that. What do you think would be the perfect budget to people have for the procedure, especially with this? Because a lot of people, I feel like, don't know that, like the massages, about massages. I personally didn't know how important it was for massages after surgery. Not only that, but just the faja, the beds, for the BBL, the pillows, everything that, the medication. What would be the best budget?
Yeah, I mean, so you really want to just, number one, go over all those things well before surgery, so you're not sitting in surgery after surgery surprised by costs. Yeah, I agree. So, you know, massages are important. Any kind of scar therapy that you want to do, any kind of adjuncts you want to do, like pain medication. We use Exparil, which is a long-lasting pain injection that I use for a lot of my surgeries. I love that. I think that works really great. Cell saver, so if you have a lower hemoglobin, or honestly, even if you have good hemoglobin.
What's cell saver?
So cell saver, what it does is the blood that we lose through the procedure, we're able to clean it and give it back to you. So theoretically, it's kind of like, let's say if you came in with a hemoglobin of 13, you should theoretically have a hemoglobin of 13 after surgery. I mean, it's never that, but that's the theory behind it. It minimizes the amount of blood that you lose, so it helps patients feel better, recover better, and it even gives patients with lower hemoglobins an option to even have surgery. So I think that everyone should have it, but I think definitely people with lower hemoglobin they're required to have it. So, making sure you go over all those questions with your surgeon beforehand, I think that's going to help you have like a pain-free and a stress-free kind of recovery.
Okay. So for the patients watching this, wanting to prepare for their upcoming surgery, what should they know?
Just do your research on me, do your research on what the surgery entails, have your budget ready to go, have all your pre- and post-operative care ready to go, and then come see us for a consultation at 3510 CoralWay in Miami, and you can always call us for a consult as well at 305-488-5707.
Beautiful.